Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop thoracic outlet syndrome pain at home. But before I do that, I'm gonna go over basic anatomy of the thoracic outlet. Then we'll go over the causes, the risk factors, the symptoms, and what you should do at home to stop thoracic outlet syndrome pain at home. What is thoracic outlet? Thoracic outlet, it's a compression or entrapment of the nerve, artery, or vein that is coming from your neck and going all the way to your arm. So there are three spots that you could have the entrapment, the compression. Thoracic outlet entrapment could occur. The neck is usually here in this area, and the nerve and the artery and the brachial plexus going down this way. So you could have the entrapment before passing underneath your clavicle bone. Also, the second spot is the entrapment underneath the clavicle bone, or the last spot is entrapment here underneath your pec muscles. So this is a very good image to visualize the three locations of the entrapment for your thoracic outlet syndrome. And you can see it here is the area for the brachial plexus and subclavicle artery and vein that can be entrapped here, or it can be entrapped in here underneath the clavicle or underneath your pec muscles. So what kind of symptoms you might experience from thoracic outlet syndrome? Well, you might have neck pain, shoulder pain, cold hands, decreased pulse in your fingers or your hand, and also weaknesses with grip, and decreased sensation or numbness and tingling in the hand. Those are very common symptoms for thoracic outlet. Some patients could also experience some muscle wasting, weaknesses with gripping, discoloration or bluish hand. So other patients could experience like fatigue in the arm area with activities, and weaknesses with the weak pulse. When you check your pulse, you will notice it's weak. So what are the causes and risk factors for thoracic outlet syndrome? One of the main causes or risk factor is motor vehicle accidents. If you have an accident and you're wearing a seat belt and you really had a bad impact, that seat belt could cause a lot of bruising, a lot of scar tissue in this area, or hitting the airbag that could actually trigger or causing a lot of scarring in this area that will cause compression on the nerve and artery and the vein. The other thing that it could be with sports activity or repetitive motion overhead for bodybuilders or any other exercises or sports activity that require that. It's common with pregnancy when you start to have a lot of swelling during pregnancy, or anatomical defect, which is less common than the other risk factors. And you can see here, this is a good image here. Number one is the first location for entrapment here. Number two is the second location for the entrapment, and three, the third location for the entrapment. So how to treat thoracic outlet syndrome? Before I go over the treatment, we have to understand the normal healing cycle, so it will make sense how to treat the root cause of thoracic outlet syndrome instead of wasting your time on just treating the symptoms. So our body has to go through 3 stages in order to heal. I'm gonna use external paper cut for visualization, but the same process happens internally from your thoracic outlet syndrome, but you don't see it because the skin covered it. So first stage of healing is inflammation. Swelling, redness, the blood start to rush to that area. Second stage, you can see it here on the second image, is a proliferation stage. That's when your body builds a scar tissue. During that stage, there's a cascade of events: scar tissue, fascia restrictions, muscle spasm, trigger points. Perfect scenario, actually, during the maturation stage, your body should get rid of the scar tissue, fascia restriction, everything in the proliferation stage and the inflammation stage. I'm gonna focus on the scar tissue for the sake of our time, just to make sense why this is important to address. So our muscle should act like a rubber band when you contract and relax. It should stretch like this. When you have a scar tissue, it's like you have a knot in a rubber band. So when your muscle contract, it will not stretch much. And when you have an accident or trauma and causing a lot of strain in this area and scarring, that scar tissue building a knot, that's gonna compress on the brachial plexus and actually could compress on a vein or artery that's actually going down to your arm. So it's very important to address these issues. We need a scar tissue when you have any strain or any accident. The problem is when you have a tear and you don't have a scar tissue, your body gonna have a permanent tear. It will never gonna heal. Scar tissue is actually the glue that keep things together. The problem is when you look in this image, after you have an injury, like in the second image here, the first image is normal healthy tissue. Your body gonna build the scar tissue very randomly, and the problem is if your body does not dissolve the excessive scar tissue, that excessive scar tissue in the way of everything and causing the compression. And that's extremely overlooked with thoracic outlet syndrome, because in the school, while I learned for thoracic outlet syndrome, do stretching, and actually the protocol for the stretching is 6 months to a year, which means if you do something for 6 months to a year, that means doesn't work. So we cannot do stuff that actually does not work. We need to work on the stuff that actually releasing the tightness. Otherwise, you're not gonna go far with the treatment. Anyway, so what should we do to treat the thoracic outlet syndrome? I'm gonna go over several current treatment that actually does not work, so you don't have to waste your time on it. And we're gonna relate that to the normal healing cycle, so it will make sense what you should do at home to really get to the root cause of the problem, so you don't have to waste your time. So what I learned from school, just do ice and stim tests, actually based on a study called temporary pain relief. But when we look at the healing cycle here, that's not gonna break the scar tissue, the fascia restriction, not gonna release the muscle spasm, that compression on your nerve and artery, and it's not gonna do much to the inflammation, that swelling here. By the way, there is not enough room in this area to have any swelling or scar tissue. Any little swelling or scar tissue gonna compress, gonna cause symptoms. So there is not enough room for inflammation or scar tissue in that area. So the other thing that's commonly used is foam roller massage. And when I go over the fascia system and the scar tissue, it will make a lot of sense why the massage and foam roller do not work. Based on a study, it provides temporary pain relief. But if you have inflamed area and you keep massaging it or rubbing it, you're gonna make it inflamed more. And massage and foam roller, it's impossibly mechanically to go deep enough to cause mechanical force to release the tightness that internally. And if you don't apply mechanical force on the scar tissue, the fascia system, or the trigger point, it's impossible to release it without mechanical force. Think about this way. If you need to unscrew a screw in the motor, and the screwdriver you have is very short, it's impossible actually to unscrew that screw. So that's what happened when we use massage, because the knuckle and the elbow, mechanically impossible to go deep to do deep release. And that's why I have certain tools that actually can go deep to do the deep release. The other thing that's been used is joint mobilization. That's not gonna do much here to the scar tissue, the fascial restriction, the inflammation. You just mobilize the bone, just moving the bone, that's not gonna do much. And actually too much of that could cause instability and inflammation. So what I learned in school, do stretching. Based on the studies, actually a recent study showed that you stretch, you're gonna cause more inflammation. And when you have tear and you stretch it, it's gonna tear more. And it's mechanically impossible with the stretch to break the scar tissue. So that it actually could cause more symptoms. The other thing is strengthening exercises. If you start to strength exercise before breaking the adhesion, you're going to cause more inflammation, more symptoms. Things will get worse. Instead of doing strengthening exercises, I personally do posture training with the patient core stabilization. That's more effective than strengthening exercises. So what should we do at home to really stop or get rid of the thoracic outlet syndrome? First, we have to work on breaking the healing cycle from both ends, the inflammation stage and the proliferation stage. So for inflammation, what I personally do is you need to avoid actually the triggers, overhead activity. If you do any sports that actually trigger the symptoms, I will avoid that until we release everything, and then we'll introduce the sports afterward. What I personally use and give it to my patient for inflammation, I use a MagnaHeal 2. This is a very strong magnet. The range of the magnetic field around 3 inches that can penetrate the body. So that's what I have them wear it to decrease internal inflammation. I also like to put my patient on anti-inflammatory diet to make sure they're not eating food that actually cause internal inflammation, so the body will heal fast. The other thing that's overlooked with thoracic outlet syndrome is possible vitamins and mineral deficiency. Because if your body is slow to heal, and sometimes the cold hand and feet and the numbness and tingling related to vitamins and mineral deficiency. And if you don't have a proper evaluation to know exactly what's going on, it's hard to figure out why you have the thoracic outlet syndrome if there's no mechanism of injury. And I personally had patients that actually had surgery to remove the tissue, and after the surgery their symptoms has not been decreased. And when we did the evaluation, there was actually vitamins and mineral deficiency that caused the numbness and tingling that actually help with the symptoms, and the surgery was not really addressing those deficiencies. So that could be happening. And the other thing is slowing the healing cycle. So one of the way you can actually do at home right now, actually take advantage of Ask ASTR. It's a free online medical evaluation. The software will help you to figure out if you have possible vitamin mineral deficiency that actually worsening your symptoms and slowing down your healing. It takes about 5 minutes, the questionnaires, and it's a free. So while working on the inflammation, we have to work on a proliferation stage at the same time. So in the home self-treatment program, I go over when you can do that in relation to each other. So I use the A3 to work on superficial scar tissue to release it from the neck. We have to really release it from the whole area, because you could have a double injury or double lesion, entrapment in here, or in here. So what I personally do, I have my patient work on releasing the scar tissue in the whole area, and then we're gonna use the A5 to release the deep scar tissue. And that's why actually I said foam roller and massage does not really go deep to cause mechanical force, because it's impossible with the knuckle or with the elbow to go deep enough to really cause physiological change. And I do a lot of release for this area with using this tool, because it can go deep enough to release deep scar tissue, fascia restrictions, and muscle spasm and trigger points. So the other thing we have to work on, it's extremely overlooked by healthcare providers, and I will briefly go over here because it's a very complex system, and it's one of the triggers to actually thoracic outlet syndrome symptoms. So is the fascia system. So you can see it here in this image. The white tissue is the fascia in here, and the superficial fascial layer, it's like a wrap surrounding the entire body. It's wrapping the entire body. very thin layer wrapping everything. So to make things complicated, but don't worry, the treatment is very simple. We have two main categories for the fascia system: superficial layer and the deep layers. The deep layers actually divided to 4 subcategories of fascia. To make things more complicated, each of these layers is actually have 1 to 2 sub layers. So you can see it here in this image. Actually, the superficial fascia wrapping the entire body, the apparatic fascia, it wraps a group of muscles, and here the epimysin wrapping each individual muscle fiber. Then we have the premiysin that wrapping a group of bundle of fibers, and then at the end you have the endomysin that wrapping each individual fiber. And that's why I said massage and foam roller will never gonna work on releasing the fascia system, because it's mechanically impossible to go to each of these layers. And when these are tight, it's gonna compress and cause the muscle to be spastic and actually compress on your nerve and artery, and actually could cause a lot of those thoracic outlet syndrome symptoms. So we have to work on all of these layers. You cannot pick and choose. I will release the superficial layer and hope for the best, because it's very common when you have a scar tissue, it's in all of these layers. When you have fascial restriction, all these layers actually affected. So what I personally use, I use the A1 to release the superficial fascial layer. I use it on the neck area and the chest area. We use that for superficial and apparatic fascia release. And then I use the A5 to go deep, to really release those adhesion around the nerve and artery, to release them. So to wrap it up, what should you do at home? Well, first of all, you need to stop any repetitive motion that aggravate your symptoms. It's very common to have more symptoms with overhead activity. I will avoid that. And you need to be active, but avoid the motion that aggravate it. I will avoid any sports require like overhead activity until we release everything to clear it up. You have to work on the inflammation and proliferation stage simultaneously. That compression, that's entrapment, commonly combination of inflammation and proliferation. You cannot pick and choose. I will work only on the scar tissue and I will leave the inflammation, or I will work only on the fascia restriction and I will leave the trigger points. It's not gonna work this way. It's a very complex area and there's a lot going on, and usually it happens simultaneously, all of these mess simultaneously. So that's conclude how to stop thoracic outlet syndrome at home. If you have any question, leave it in the comment section below and I will answer it in the future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to astrinstitute.com.